I wanted to introduce to you today one of my friends, Asko. Asko first came to us as a patient several years ago at Paws in Motion, and he's such a darling nature that he's actually moved on to helping us to educate veterinary nurses at the university and to also star in some of our videos for Paws in Motion about how to do doggy massage. Today, I want to tell you a little bit about Asko's condition. He's obviously a beautiful German Shepherd. He's 8 years old, and when he was a puppy, he had a couple of issues. So one thing is that his mummy, when he was a baby, his mummy chewed off a couple of his toes. So this is a normal doggy foot with 1, 2, 3, 4 little pads, and you can see that this one here is a little bit funky. There's his main foot pad, and then he's got 1, 2 funny toes. So mummy took away the other toes, which sometimes occurs when the puppy's mum is a little bit confused about how they should work as a mother, what they should do as a mother. So it sometimes does occur. Now, that's no problem for Asko, because now that he's in a lovely home, he's all looked after, but he does wear a pair of very cool boots that I'll show you a little bit later. So Asko came to us not for his toes, he came to us because he also had hip dysplasia as a puppy. Hip dysplasia is a condition where the thigh bone, the head of the thigh bone, does not sit as well into the cup that holds it, the ball and socket joint of the hip. So there's a little bit of looseness, and over time there might be some moving, and sometimes we might even see the head of the thigh bone or the head of the femur pop right out of where it should be. And actually that happened with Asko. So he had a surgery on his left side here, which was called a femoral head and neck osteectomy. That sounds terrible, doesn't it? Basically, it means that we remodeled the joint so that the bone would not be rubbing on bone, and so he would feel more comfortable. After his surgery, he didn't receive quite as much physiotherapy as he could have, which would have helped to stretch the muscles and give him a better range of motion in moving. However, he's done very well, but he also has the other hip affected on the other side. He also has some tight muscles down the back of his leg, the hamstring muscles that run under here. And so what we do now with little Asko is we maintain the hip joints using therapeutic laser to keep them comfortable. We massage these muscles at the front and the back of the leg to keep them comfortable, to keep them stretched and as soft and useful as those muscles can be. So these are Asko's boots that I mentioned. Normally we don't really recommend doggies wearing boots because it can reduce the amount of feeling that they have through their toe pads and therefore the sensation of knowing where to walk. But for Asko, because he's got those funny little toes, then he actually walks better and feels more comfortable and can go further when he's wearing his boots. So he's all fit and ready to walk home.